You're listening to Oncology on Doctor Radio, SiriusXM 81.
And welcome everybody to Doctor Radio, SiriusXM 81. This is the Oncology Show, 877 NYU Docs or 877-698-3627. And of course, I'm still missing my radio wife, Sylvia Formenti, who hopefully is on her way. But I'm going to introduce our next guest, Cortney Nicolato. Welcome, Cortney.
Welcome. Thank you for having me. I appreciate it.
I was reading the intro on you and all the things that you do, and I thought maybe it's best if you just tell us what you did.
No worries at all. So I am the Vice President of Healthcare Strategies for a technology firm called Get Real Consulting. And so we develop consumer applications for patients, for consumers to help manage their health and their well-being. And I formally, prior to joining Get Real, was the National Director of Health Information Technology Business Development at the American Heart Association. So I've had the pleasure of being in health IT for about a decade now. Okay,
so health IT. So go again. Tell me a little bit about you're developing. Tell me again what you do. Sorry, I'm wrapping my head around this health IT. I have a limited understanding. I need my Sylvia to be here.
I
know. And she's here. She just walked in. Okay,
welcome.
Sylvia, I'm introducing you to Cortney Nicolato, who is going to tell us what she does again.
Yes, Cortney, please do.
No worries. Dr. Formenti, great to meet you. And,
great to meet you, too.
So when we talk about health information technology, there's a number of different things that come to mind. So, what many people understand quite quickly, they're seeing their doctor's office become what they're deeming electronic now. So a lot more computers in the practices, a lot more clinical information being shared electronically, which, is exactly where we want the industry to go because it's incredibly important for a number of reasons. Where I work in is more specific around helping patients being engaged and empowered in their health through technology. So you've probably heard a number of different apps on the iPhone and Android that are out there that do everything from help someone manage their heart rate to help someone manage a complex chronic condition by just giving them a to-do list on things that they should be doing every day, like checking their blood pressure and their blood glucose.
Right.
So my company, which is Get Real Consulting, has been building these patient-generated or patient-focused applications for about a decade now, and we've built over 50 different applications for all major associations and groups and hospital systems, both here in the U.S. and globally.
So if a patient wants to get real, how does, let's say I want to use your services, what is the next step?
So we create applications for organizations, and one of the that we'll talk about today is the Dr. Susan Love Research Foundation.
Right.
And so, you go to your local, you go to your hospital, you go to your provider, and you ask, do you have a personal health record or do you have an online application at the elementary level to store my health record and my information? But then do you have any tools or resources that can help me manage my conditions, whatever that may be?
So it's interesting you're bringing it up because our department is just going live on Epic Healthcare, and fascinating challenge. And I can see, a great at the beginning some kind of learning curve, but eventually extraordinary possibilities to optimize at many levels. Like communication among doctors, communication within a department among nurses and other specialties, and so on. And enormous amount of record keeping and rigorous documentation. So I think it's all of this good and nice and accountable and databases of extraordinary power and so on. All of this great. But the reason I'm bringing it up, and Epic is one of many, so it's not necessarily, I'm not advertising specifically for Epic. But I'm just saying that, the reason I'm bringing it up is because, there is an interface where the patient could be included in this process. And I think this is extraordinary because one of the main barriers, and particularly in oncology, in my mind, has been this monopoly of information. So just you're keeping all the information within the healthcare providers, and some of the information is really difficult to explain, but not impossible. First thing, and I cannot imagine a situation where information should be really spare to the patient unless the patient asks or the user asks so. So their patients really don't want to know, and they say it very, very clearly. But otherwise, any access and any transparency seems to me, absolutely of the essence. And I believe many of these services enable that. What is your point of view from the user point of view?
Yeah, we're seeing a groundswell of patients who are really interested in knowing their information and health record. Everyone has a story in some way, shape, and form that they didn't have their health record or their information when they needed it in a time of crisis. I'm going through right now, my grandmother's in the hospital, and just having things like her medical legal forms, her do not resuscitate forms, or things like that, having it in your personal possession is incredibly important. Now you take not only having that information, but helping people do something with it. Helping people understand what a high blood glucose level means if you're a diabetic and what the ramifications are, or, how to make their lives easier and make their condition easier to manage on a daily basis. That's what we're seeing is the transformational shift. It's from just storing information, but now really empowering and engaging to make behavioral change or just add it into the lifestyle of all Americans.
Do you think there are drawbacks? Do you think you see any negatives?
I think there's some negatives, I think, in the industry right now in that we're continuing to get clinicians and providers and hospitals on board. So, not all data is on a patient or information or clinical information is there just yet. So that's been a negative in that, that groundswell is continuing, and it's just not at that place. Eventually it should be that everyone is connected and that there's a holistic view of that patient at all times. But to me, those are challenges we can overcome, and I think there's a lot of regulation and policy and things that are occurring with government to help with that.
So do you see issues of confidentiality not being protected? I'll give you a crazy example, but maybe you go to one doctor, you don't want your doctor to know not necessarily a health information, but some kind of personal information you shared with another doctor?
Yeah, I think that there is always, when we're talking about medical information, there is always concern about security and privacy. But the standards are out there to ensure that, security and privacy are taken, into account at the highest level at all times. Right. And so organizations like us, like others, breaches, I'm not going to say breaches don't happen because they do. Right. And I think many of them hit the news quite often. But, I think also same thing with financial information, right? It's just as important.
Right.
So, I think that, we continue to look at making sure that it is as secure and private as possible, and allows for the ability for patients to share information with whom they deem appropriate. Right. Is it their family member? Is it another provider? Is it a dietitian? Let them have the controls to share that with and with whom they deem appropriate.
So it's very dear to me to talk about Susan Love's Research Foundation, so I'm going to go back to that for a tiny minute. So tell me more how you got involved with that.
So we've had the privilege of working with Dr. Susan Love and her entire team now for about a year. They approached us through one of our partner organizations, which happens to be Microsoft, and we began to speak with them about their vision and what they wanted to do with the Health of Women study. Dr. Love, I had the privilege of sitting next to her at a meeting, and she was just like, all of these men and women, 280,000 are being diagnosed just last year. 108 women will die each day of breast cancer. Something's got to give.
Absolutely.
And we can't continue to wait until the years after traditional research ends and something's publicized and processes are changed and workflows are changed to really eradicate breast cancer in a way that we need to. And she had this vision of continues to have this vision of how do we create a worldwide research study, online research study that allows people and organizations to come, women, men of any 18 and over can come in at any time and take these surveys and provide this wealth of data on those who may have had breast cancer, who have never had breast cancer, who have never had a risk factor for cancer, but watch them over time and then be able to provide this amazing wealth of data to researchers so that we can eradicate breast cancer rather than just treat it.
Yep. Okay, so, is this the first time that they do this kind of survey, or?
Yeah, what's really empowering and so exciting about the House study is that it's the first of its kind in a number of different ways. Okay. One, it's a ground.
I have to say that knowing Susan is not a surprise to me. This is the first.
It doesn't surprise no. Anyone who knows Dr. Love knows that this is no surprise that she wants to.
Certainly is an initiator. Yes, she's certainly she sees it before anybody else does. Absolutely.
Exactly. And we weren't surprised either when we first met her, and it was a large task for a number of reasons. One, it is the first of its kind of an online study. Traditionally in traditional research, requires cohorts and small populations and years for that info to hit the hands of your provider or your clinician. Now this is an online study that actually goes directly to the patient or to the person who signs up. They take a short survey, and then they'll be prompted every couple of weeks or months to complete another survey in a very easy-to-use system. So,
and what is the survey tapping on specifically? Which kind of questions?
So the survey captures a number of different things. So we plan to follow these study members over time. Now, you have the ability to come in and out of the survey as you wish. It's up to you and at your discretion. But it's going to allow us to track things like lifestyle, environmental exposure, any other potential causes of breast cancer in the most kind of thorough manner possible. So all that is asked is that you have an email address so that we can keep in touch with you on a regular basis. And then we will continue to ask questions based on who you are. So say you are a woman who's had a child over 35 and has been diagnosed with breast cancer. We'll have a catered survey to ask of you. If you're a 34-year-old woman who has not been diagnosed, like myself, then you'll receive a different survey. So we're really going to try to cater it as easy as possible to the men and women who participate because we value their time. We value their effort in helping us eradicate breast cancer and utilize the technology as best as humanly possible.
All right. So, and how long you think you'll keep it open? I mean, is it planned to stay open for how long? I mean, how vertically in terms of time?
So we're in for the long haul at Ms. Susan Love's Research Foundation. Our goal is to watch these men and women and their experiences over time, up to 20 or so years.
Fantastic.
We know we can't cure breast cancer today. There's a lot of things we don't know about breast cancer. We don't know the causes. At that level, we don't know.
So now, before you had this kind of tool that you are, somehow applying to this kind of to this project, if people wanted, I mean, the mechanism was like the SEER registry system, right? And try to extract, stuff that is not that easy to extract often. So you will get, maybe the code for payments for a certain service as a surrogate of the fact that people had the service. So if they had the service, they had the disease.
And exactly.
But really, there was no way to ask specific questions. So if you want to ask, is you eat spinach in your diet, there was no way to dig this out retrospectively. Right.
Exactly. And I, prior to joining Get Real, I was National Director of Health Information Technology at the American Heart Association. So one of my responsibilities was registries. And, we could get data. It was very hard to do, but we got it. But we couldn't ask these types of questions, and then we couldn't add questions as we were going along, right? So we have on healthofwomenstudy.org, you can go on, you can actually provide information or your own questions on what you think should be asked, and the team takes that into consideration for its next survey and next study that we put out. Additionally, as trends or as things are changing in the health industry related to breast cancer, we can acknowledge and target that today rather than 2 years from now.
So it just occurred to me that from a industry point of view, you are going to sit on very valuable information. For instance, if you're asking how much soy is part of your diet, you will have a cross-cut, international, I guess, of, these people that signed in, so that's some concern for breast cancer at least, how much soy they consume, right? So if you are in the business of making soy products for, health food or whatever, you will want to have that information. Is industry approaching it all, and who owns this kind of information at the end?
So, great question. So the Dr. Susan Love Research Foundation will be the primary keeper of the information. So this includes both the research data as well as that personal contact information.
Right.
What is incredibly powerful and what Susan Love and her team, as well as her partnership with the City of Hope Comprehensive Cancer Center, that they're going to analyze that data that they collect, but then they're going to make it available in an anonymized way. So no one will have your personal contact information, but the researchers can then use that data for various research studies.
So it's going to be a platform that is freely available to interested researchers. So you have to put together a proposal, it will be in a scientific review, and if the proposal is worthwhile, the data could be shared.
Correct, and there is going to be our goal is that we'll have 1 million men and women taking survey and taking these series of surveys, and then making this available. Over 165 researchers have already benefited from projects that Susan Love and her team has done. Our goal is to have thousands and thousands of researchers be armed with this data. And so
it's just an idea of seeding evidence into the research community. So then, it could build into much more than a seed and enable hypotheses and possible behavioral changes and so on and other studies.
Yes, correct. And we know that in the research world currently, there is this upshift now of taking into account what they call patient-reported outcomes measurements.
Right.
And so really understanding how is this, whether it's a treatment, whether it's a way of life or a lifestyle change, how does this personally affect the patients? In what way? And so this is going to be, I think, the gold standard venue to collect that information.
All right, so we are privileged to have Dr. Shashua joining us.
I'm freezing.
After he
are
took
you
his
cold?
No, I'm fine. I'm a normal temperature.
Freezing cold.
It's freezing cold. He has a blood pressure drop, so you're starving, you're not eating, you're dieting. What's going on?
I'm on a liquid cleanse, actually. Did you notice that?
I don't want to.
Did you notice I looked good today?
No, because we have an event tonight. That's why you're dressed up.
No, well, I've dressed up, but unfortunately, as you know, I've lost some weight. And
unfortunately, that's really.
And I don't have any clothing that fits.
So. I feel your pain right now. I've just lost 32 pounds.
Congratulations.
So unfortunately, Cortney, we have this event tonight, and I'll be damned if I'm going to buy a new suit for this. So I look at my clothing in the closet, and I have the fat suits, and I have the really thin suits, and very little in between. So I find this one suit that fits. In between. There's still a bit of a
it's
fat
called
suit.
The in-between
And I
suit.
wear it, and I look stunning, of course, as you're going to say.
You look fantastic.
And I come to work, and there's a huge hole in the leg. There's a huge,
Where?
I'll stand up and show you, but don't touch.
Don't touch.
So right here, see that? See that? It's totally
Cannot
taut.
believe it. Do I have to sew it?
So now I'm in this twixt of this dilemma. What to do? I could. My wife is like, go find a tailor, and I'm like, it's the middle of office hours.
I like to find, Jesus.
I'm gonna go like this, and I'm hoping people don't check out my legs. I know it's gonna be hard, Sylvia.
I know it's going to be impossible. Impossible. How can we restrain ourselves? Right.
Right. So that's what it is. But yes, we actually on the weekend we went to the New York City Food Fest, and I ate a lot, and so
That's why you exploded with a whole.
No, that's what my wife is like doing this juice cleanse that she ordered from
Usually,
Fresh Direct.
When I do that, I faint.
You did a juice cleanse? Well, I'm in the middle of cleansing.
You're freezing cold.
I'm cleansing now, and I just, I don't feel like.
I don't go, Fresh Direct. I make my own juices, but after like 2 meals, I need substance. But anyway, close.
All right, enough of this. We'll talk about my cleanse later.
All right. So just to publicize a little bit for a minute your survey. So first of all, we want to reintroduce Cortney Nicolato, who is
Nicolato. Is that how you say Nicolato? That is so good.
How do you say it in this country? Nicolato. No, how do you say?
No.
How do you say?
I have a little twinge. It's Nicolato.
Nicolato. Okay, Nicolato. Who is an expert on healthcare and information technology. And she is the Director of Quality and Health IT Business Development to the American Heart Association and serves as a co-chair for the Certification Commission for, you're doing it all, health IT, cardiovascular work group. My God, if I need the health IT, you're the woman.
Well, I've been around the block as it relates to health IT.
Right,
we're a young breed. The health IT really has seen a huge expansion over the last decade. So I had the privilege of been working in this industry for about 12 years now. It's been a lot of fun. A lot of fun.
So the future is that behind your, I guess it can be very stylish, behind your watch, so your stylish watch, you will have a microchip with all the information about yourself, your CAT scans, everything, or not?
There's a lot. I attend a lot of conferences for our Get Real consulting, and we are learning a lot about what does that look like. Is it sensors? Is it and the sensors, are they
a little terminal
in your body? Are they attached to your body?
Wow.
What does that look like? But that world is coming up. I think there's still a ways to go, and I think that there's still some concerns on the patient perspective about invasiveness. But at the end of the day, really, the key importance is that I can't encourage enough that patients really take accountability in storing your own health information, keeping your own record, be your own health advocate related to your health information is incredibly, incredibly important. And doing not only that for yourself, but for your spouse, for your children, for your parents, for your grandparents. Be that advocate, because you are the one that knows every test and every medication and every aspect of your health journey better than anybody. So, be that advocate.
Wow. So are you going to have your microchip with all the information on you?
I have it now.
You have it now, right? We don't want to ask where. So okay.
Yeah.
All right.
Now, I'm storing all my health information and my information and my kids' information, even just at the immunization record level. How important is that for a working mom like myself? And storing that all in our program, which is called Instant PHR. So it makes my life as a mom a lot easier.
A lot easier, yes. I realize that is true because, I spent my life with 3 kids retrieving immunizations, finding that one was caught up, the other one was over-immunized, the other one was not immunized at all, so it was like all over the place. I understand that. And then there is dental x-rays, and then there is, baseline blood counts, and so there is always something. Yes. This is when you're healthy. Forget when you get sick, right?
Yes. I've heard and I've talked to a number of individuals, and I've seen files that literally you can't pick up by yourself. And, my grandmother, one of my grandmothers just passed away in January, but had heart failure, was in a nursing home facility, and was in the hospital for a long period of time. And, I have another grandmother who's currently in the hospital, and just digitizing those records, getting that in a place where we can view it, understand it, and I can help from 1,800 miles away, help with my grandmother's treatment and care, makes me have a comfort level for being involved even so far away, but also helps my family in the decisions that they have to make.
All right. That's very impressive.
Yes.
So, and the last thing I want to ask you before we have to go for a break, talk a little about, before we go to a break, we have to give away the numbers because I've been really bad. So, where are we, Abe? Where are we? You're oriented?
No. You can go ahead. I was
here
for the first hour myself. So
yes, I know you've been an angel.
Yes. So I was
you played
missing.
Sylvia and Abe. Yes.
Yes.
So
go ahead.
We are at Dr. Radio, the Oncology Show, on SiriusXM 81, and the number here is 1-877 NYU Docs or 1-877-698-3627. And again, speaking with Cortney Nicolato, and I cannot say it in the American way, so it must be an American way, but in Italian is Nicolato, and she has a name, Italian name, I can't do anything, and who is in charge of strategic planning and solution design for Get Real, which is a fantastic initiative, seems to me. Is it applied only to health or more than health?
Well, currently we're working just in the health space.
Right.
We do intend to expand out because as you can probably imagine, what we're doing here is most definitely above and beyond even just the health space.
Right.
And with the Susan Love, with the project, the Health of Women study that we've done with Susan Love, we envision that this is going to be available to more than just breast cancer because of the information that we're gathering is going to be way more powerful. It'd be a crime for us not to offer this even outside of the realm of breast cancer. So, so from that regard, we're expanding, and then also as Get Real Consulting, we're expanding and plan to expand even outside the health arena.
Very good.
All right, so we're going to take a break.
Yes.
So, Cortney, thank you so much for being with us today.